Whether you work in a hospital, nursing home, or other healthcare facility, all employees need to be instructed on the proper procedures to limit their exposure from coming into contact with blood or other bodily fluids during an emergency situation. This training program is designed to inform and educate any and all employees who can be reasonably expected to have contact with blood or other bodily fluids in the performance of their work duties. You will be instructed on the proper procedures to protect yourself and to limit your exposure to blood-borne pathogens. In this training program, we will familiarize you with the contents of the OSHA standard, blood-borne diseases, preventing exposure, proper protective equipment, signs and labels associated with blood-borne pathogens, procedures to follow if exposed. Blood-borne pathogens, or BBP for short, are disease-causing organisms that are present in blood. Other potentially infectious materials, OPIM, are any body fluids or unfixed tissue. The relative risk of exposure to BBP is relatively small. However, the effects of an exposure can lead to deadly consequences. In 1991, because of serious concerns about these exposures, OSHA mandated the regulation standard 29 CFR 1910.1030. This standard was again updated in 2001 to incorporate new regulations from the Needle Stick Safety and Prevention Act of 1999. OSHA defines blood-borne pathogens as disease-causing microorganisms found in human blood, as well as human blood components and products. In addition to the OSHA regulations, your employer should have developed an exposure control plan. This is a plan developed by your employer that addresses the requirements of the OSHA regulation. The exposure control plan should be reviewed annually and includes the following: a determination of each employee's potential exposure to BBP based on their job duties, methods to limit or eliminate exposure, and updates that reflect changes in technology that may further reduce or eliminate exposure, procedures for investigation of exposure incidents, documentation of the required annual update process, including non-managerial employee participation in the development and updating of the exposure control plan. Both the OSHA regulations and your employer's exposure control plan are to be made available to all employees. Contact your training instructor or your supervisor to review copies of them. There are many blood-borne diseases. We will focus on the three major viruses that cause the greatest threat. They are HIV/AIDS, hepatitis B, and hepatitis C. HIV is the virus that leads to AIDS. It is estimated that over 1 million individuals are living with this virus in the U.S., with 1/4 of those being undiagnosed. There is not a cure or a vaccine to combat this deadly virus. Symptoms at the onset of this disease vary, but include rapid weight loss, dry cough, recurring fever or profuse night sweats, profound and unexplained fatigue, swollen lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, white spots or unusual blemishes on the tongue or in the mouth, pneumonia, memory loss, depression, and other neurological disorders. Hepatitis B is a virus that can lead to fatal liver failure in about 25% of those infected. Current estimates show that about 1.2 million people in the U.S. are infected, with an additional 60,000 new cases each year. There is no cure for hepatitis B, but there is a vaccine available. The vaccine consists of a 3-dose injection that has been proven to be safe, with a 95% effective rate at preventing the disease. Your employer, at no cost to the employee, should make this vaccine available, especially to employees who are at a high risk rate of exposure. This vaccination is so important that OSHA requires you to sign a release form if you decline the vaccination. This vaccination should be administered before any exposure should occur. However, an after-the-fact vaccination is available, but may not always prevent the disease. The common symptoms of hepatitis B include fatigue, abdominal pain, loss of appetite, nausea or vomiting, joint pain, jaundice, yellowing of skin. Hepatitis C is the leading cause for liver transplants and can lead to death in approximately 5% of cases. Current estimates show that around 4.1 million people in the U.S. are infected, with an additional 26,000 new cases each year. About 80% of those infected show no symptoms, but they are similar to those of hepatitis B. There is no cure or vaccine for HCV. HIV/AIDS, hepatitis B and C, and the many other viruses transferred within blood-borne pathogens do not always show symptoms immediately. They can even lay dormant for several years. These symptoms can be caused by other diseases as well. The only way to determine if you are infected is to see a healthcare professional and get checked out. This training program has limited its content to workplace exposure to blood-borne pathogens and will not address sexual transmissions. Therefore, occupational exposure to blood-borne pathogens enters the body through parenteral exposure. This is where pathogens enter the body through breaks in the skin or through mucous membranes. Most exposures occur through needle sticks, human bites, skin abrasions or cuts that come into contact with potentially infectious material. Infectious material can include blood or blood products, human tissue, vaginal secretions, any other bodily fluid with blood in it. One of the most important means of preventing exposure to blood-borne pathogens is to use the standard precautions rule. You treat all bodily fluids, with the exception of sweat, as if they are infectious.